is, let's see, first of all, I'm Beckie Freiberg. I'm the faith community nurse here at Derry Presbyterian Church, and we're going to be talking about diabetes. It's Diabetes 101, type 2, and pre-diabetes. Let's talk about it. So the scripture reading for today is, I can do all this through him who gives me strength. This is Philippians 4:13 NIV. I can do all this. Let's see, this verse reminds us that you can find strength in God to face any challenge or difficulty, including managing diabetes or any other health condition. It encourages reliance on God's power to overcome obstacles and persevere through trials. So let's get started here. What is diabetes? That's the big question. Diabetes is a chronic medical disorder characterized by high blood sugar levels over a prolonged period. Prolonged period is a key word there. It occurs when the pancreas doesn't produce enough insulin or when the body cannot effectively use the insulin it produces. There are primarily two types of diabetes: type 1, where the body fails to produce insulin, and type 2, where the body cells become resistant to insulin. With diabetes, your body either doesn't make enough insulin or can't use it as well as it should. And diabetes is a chronic, meaning long-lasting health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into sugar or glucose and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin, and insulin acts like a key to let the blood sugar into your body's cells for use as energy. With diabetes, your body doesn't make enough insulin or can't use it as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems such as heart disease, vision loss, and kidney disease. There isn't a cure yet for diabetes, but losing weight, eating healthy food, and being active can really help. Other things you can do to help is to take medication as prescribed, get diabetes self-management education and support, make and keep healthcare appointments. Let's see, diabetes is the 8th leading cause of death in the United States, and about 38 million US adults have diabetes, and 1 in 5 of them don't even know they have it. Diabetes is the #1 cause of kidney failure, lower limb amputation, and adult blindness. And in the past 20 years, the number of adults diagnosed with diabetes has more than doubled. And there's a lot of speculation on why this is happening, and most people seem to think that it's part of the food source. And let's see, 98 million US adults, or 1 in 3, have prediabetes, which puts them at risk for type 2 diabetes within 5 years and at risk for other serious health problems, including heart attack, stroke, blindness, kidney failure, loss of toes, feet, or legs. Prediabetes, and this is where the blood sugar levels are higher than normal, but not high enough for type 2 diabetes. We'll get into this a little bit more later. It increases the risk of developing type 2 diabetes, heart disease, and stroke, and may be prevented or reversed with the adoption of healthy lifestyle changes. And prediabetes is a serious health condition where blood sugar levels are higher than normal, but not yet high enough to be type 2 diabetes. Approximately 98 million Americans have it. And of those with prediabetes, more than 80% don't know they have it. And prediabetes puts you at risk for heart disease. So let's see. Let's play the video. I have a little video here that talks about prediabetes.
Hi, I'm Dr. Snodgrass. I'm a physician here at First Primary Care, and today we're talking about prediabetes. What is prediabetes? Prediabetes, like the name suggests, is a diagnosis that precedes diabetes. Most of us know that diabetes is a diagnosis made by a person having elevated blood sugar levels. You can think of it kind of like the tip of an iceberg. So if a ship sees the tip of an iceberg out in the horizon, that ship is going to change course and avoid hitting the iceberg. Prediabetes is like the tip of a sugary iceberg. If a person is diagnosed with prediabetes, that person needs to change course or possibly go on to develop full diabetes. About 25% of people with prediabetes within 3 to 5 years will go on to develop full diabetes. So if we have 4 people in the room, one of those people is going to go on to develop full diabetes within 3 to 5 years. How do we diagnose prediabetes? We typically use 2 different tests, the hemoglobin A1C or the fasting blood sugar level. The hemoglobin A1C is an actual measure of how much sugar is sticking to the red blood cells as it circulates around your bloodstream. And the fasting sugar is a measure of the level of sugar in a person that hasn't eaten or drunk anything for the last 8 to 12 hours. For all of us, when we eat, food goes in our mouth, down our esophagus, into our stomach, into our intestines, and then the food that we eat, the sugars that we've eaten, absorb across the lining of the intestines directly into the bloodstream. Those sugars circulate around in the bloodstream and then signal the pancreas to secrete insulin. Insulin goes out into the blood, attaches to those sugars, and brings them into the tissues of the body. In people with prediabetes and diabetes, those sugar levels are left at a little bit of a higher level than the normal level. Why do we care if someone has an elevated blood sugar level? Think of these excess sugars as small shards of glass, sugary shards of glass circulating around in the bloodstream. As they're circulating, they're making small nicks and micro damages in the walls of the blood vessel. These small damages accumulate over time to become much larger damages. This is why people with long-standing diabetes are more likely to have heart attacks, strokes, trouble with their vision, kidney failure, and loss of feeling or nerve pain in the hands and the feet. What can we do to treat prediabetes? At this stage, the treatment is primarily diet and lifestyle changes. We don't typically use medication at this time. So for diet changes, you will want to avoid sugars, sugary drinks, processed foods, anything that can elevate your blood sugar. And you'll also want to try to fast between meals or fast for a portion of your day. This allows the pancreas, that organ that secretes the insulin out into the blood, to rest. You'll want to add exercise and strength training because this helps us to metabolize those sugars that all of us are inevitably going to eat. There's one additional thing that we're doing with our patients these days. We're using continuous glucose monitoring to help the patients make changes in their diet. So as the name suggests, this is a monitor that the patient wears on the back of the arm, and it continuously monitors the patient's glucose for a 24-hour period of time. The monitor is worn for 2 weeks, and that entire time we're able to see what the sugar level is in the patient's blood. So if someone eats a meal, we can see immediately within 30 minutes what the blood sugar level change is. And that can help people make changes in their diet versus a hemoglobin A1C, which we can only test about every 3 months to get a reliable indicator of the change that's made, or the fasting blood sugar, which can only be done on a patient that's been fasting for 8 to 12 hours.
Okay, that covers prediabetes. Now we're going to go on to type 2. I'm not going to spend a lot of time here because it's kind of a whole different ball game. But type 1 diabetes is thought to be caused by an autoimmune reaction. The body attacks itself by mistake, and this reaction stops the body from making insulin. Approximately 5 to 10% of the people who have diabetes have type 1. Type 1 diabetes can be diagnosed at any age, and symptoms often develop quickly. If you have type 1 diabetes, you'll need to take insulin every day to survive. And currently, no one knows how to prevent type 1 diabetes. Type 2 diabetes, here we go. Type 2 diabetes is a condition that happens because of a problem in the way the body regulates and uses sugar as a fuel. This long-term condition results in too much sugar circulating in the blood, and eventually high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. In type 2 diabetes, there are primarily two problems. The pancreas does not produce enough insulin, and insulin responds poorly to and cells respond poorly to insulin and take in less sugar. Type 2 diabetes used to be known as adult onset diabetes, and commonly known too as sugar diabetes. But both type 1 and type 2 diabetes can begin during childhood and adulthood. Type 2 is more common in older adults. About 90 to 95% of people with diabetes has type 2, but the increase in the number of children with obesity has led to more cases of type 2 diabetes in younger people. And type 2 diabetes develops over many years. You may not notice any symptoms, so it's important to get your blood sugar tested if you're at risk. Currently, there is no cure for type 2 diabetes. Losing weight, eating well, and exercising can help manage the disease. If diet and exercise aren't enough to control blood sugar, diabetes medication or insulin therapy may be recommended. And
Diabetes. It was first discovered over 3,000 years ago, just before the invention of the Twinkie. Diabetes has two types, type 1 or juvenile diabetes, and type 2 or sugar diabetes. The one that is preventable, the one any of us can get, is type 2. It occurs when your body stops producing insulin, or it can't properly use the insulin it's creating. It means the body can't break down the sugar it's making, which is terrible because if you haven't noticed, we eat a lot of sugar. So what happens is a bunch of small symptoms start to pile up. You get thirsty, vision gets blurry, there's a feeling of tingling in the hands or feet. Then over time, these minor problems can turn into bigger ones, like high blood pressure, stroke, kidney failure, gangrene, or blindness. Yes, blindness. This is all very alarming, especially since you are at much higher risk for dying of diabetes than, say, breast cancer, because people are far more likely to get shamed for having diabetes than get supported. It turns out, just by being African American or Hispanic means you can have a 50% higher chance of having diabetes. And despite all of the outrage over obesity, we are still bombarded with food choices that just accelerate the problem, which can just lead to a costlier crash later. But with support, statistics can be reversed, even if you already have diabetes. Reducing how much you eat and what you eat matters. Getting out, exercising, even just walking can change the course of the disease. And unlike so many other diseases, by changing your lifestyle, type 2 diabetes can have a happy ending, and even something medicine rarely achieves. Imagine that.
Hello, I'm Dr. Kimberly Dawn Wisdom. A person can be affected by diabetes for 10 years and not even know it. It puts that person at risk of developing tremendous complications such as lower extremity amputation, blindness, and significant heart disease. However, those complications are entirely preventable with proper nutrition, physical activity, and the appropriate medication prescribed by your doctor. Remember, develop a partnership with your doctor or healthcare provider along your wellness journey. And most of all, be mindful and live well.
Okay. One of the side notes here is that diabetes adds an additional, let's see, they said additional $20,000 per year per patient to healthcare costs. So, okay. Next one we're going to talk about is gestational diabetes. And gestational diabetes develops in pregnant women who have never had diabetes. If you have gestational diabetes, your baby could be at higher risk for health problems. And gestational diabetes usually goes away after the baby is born. However, it increases your risk for type 2 diabetes later in life. Your baby is more likely to have obesity as a child or teen and develop type 2 diabetes later in life. Risk factors. Factors that may increase the risk of prediabetes and type 2 diabetes include being overweight or obese is a main risk. Age, the risk of type 2 increases with age, especially after age 45. Family history, an individual's risk of type 2 diabetes increases if a parent or sibling has type 2 diabetes. Inactivity, the less active a person is, the greater the risk. Physical activity helps control weight, uses up glucose as energy, and makes cells more sensitive to the insulin. Pregnancy risks. The risk of developing type 2 diabetes is higher in people who had gestational diabetes when they were pregnant and in those who gave birth to a baby weighing more than 9 pounds, 4 kilos. Race and ethnics, race and ethnic, I can't say it. Although it's unclear why people of certain races and ethnicity including Black, Hispanic, Native American, and Asian people, and Pacific Islanders, are more likely to develop type 2 diabetes than white people are. Fat distribution, storing fat mainly in the abdomen rather than the hips and thighs, indicates a greater risk, so the apple person. The risk of type 2 diabetes is higher in men with a waist circumference of 40 inches or more, and in women with a waist measurement of 35 or more. Blood lipid levels, an increased risk is associated with low levels of high density lipoproteins, or the HDL, or what I always call it is the healthy cholesterol, is the good cholesterol, and high levels of triglycerides. Prediabetes is a condition in which the blood sugar level is higher than normal, but not high enough to be classified as diabetes. Left untreated, prediabetes often progresses to type 2. In women who have polycystic ovarian syndrome, having PCOS is a condition characterized by irregular menstrual periods, excessive hair growth, and obesity, and that also increases the risk of diabetes. Mm-hmm. Symptoms. Symptoms of diabetes often develop slowly, and in fact, you can be living with type 2 diabetes for years and not even know it. When symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing wounds or sores, frequent infections, numbness or tingling in the hands and feet, and areas of darkened skin, usually around the armpits and neck. So let's talk about how insulin works. Insulin is a hormone that comes from the pancreas, a gland located behind and below the stomach. Insulin controls how the body uses sugar in the following ways. Sugar in the bloodstream triggers the pancreas to release insulin. Insulin circulates in the bloodstream, enabling sugar to enter the cells. The amount of sugar in the bloodstream drops, and in this response, the pancreas releases less insulin. Now let's talk about the role of glucose. Glucose is a sugar. It is the main source of energy for cells that make up muscles and other tissues. The use and regulation of glucose includes the following. Glucose comes from two major sources, food and the liver. Glucose is absorbed into the bloodstream where it enters the cells with the help of insulin. The liver stores and makes glucose. When glucose levels are low, the liver breaks down stored glycogen, which is glucose, into glucose to keep the body's glucose level within a healthy range. In type 2 diabetes, this process doesn't work well. Instead of moving into the cells, sugar builds up in the blood. As blood sugar levels rise, the pancreas releases more insulin. Eventually, the cells in the pancreas that makes the insulin become damaged and cannot make enough insulin to meet the body's needs. Wow.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
And here we're going to talk about complications. It says type 2 diabetes affects many organs, including the heart, blood vessels, nerves, eyes, and kidneys. Also, factors that increase the risk of diabetes are risk factors for other serious diseases. That means that the high blood sugar levels can help cause or help or increase the risk of plenty of other serious diseases. Managing diabetes and controlling blood sugar can lower the risk for complications and other medical conditions. And let's see, type 2 diabetes affects many major organs, including the heart, blood vessels, nerves, eyes, and kidneys. Let's see, heart and blood vessel disease. Diabetes is associated with an increased risk of heart disease, coronary artery disease, which we talked about last time in the heart lesson, heart attack, stroke, high blood pressure, and narrowing of blood vessels, a condition called atherosclerosis. Cardiovascular issues are the most common type of long-term diabetes complications. Nerve damage in limbs. This condition is called neuropathy. High blood sugar over time can damage or destroy nerves. That may result in tingling, numbness, burning, pain, or eventual loss of feeling that usually begins at the tip of the toes or fingers and gradually spreads upward. In many long-term diabetics, you'll find that they have a lot of problems with their feet. And with the neuropathy, they can't feel when their feet get damaged or pressure or anything like that. So they usually have a lot of damage to their feet, which can lead to amputation of toes, foot, and even legs. Other nerve damage it damages nerves to the heart and can contribute to irregular heart rhythms. And as we learned last time, that irregular heart rhythms are a major cause of AFib, and that can lead to death. Nerve damage in the digestive system can cause problems with nausea, vomiting, diarrhea, or constipation. And nerve damage may also cause erectile dysfunction. Kidney damage diabetes can lead to chronic kidney disease or end-stage kidney disease that cannot be reversed, and that may require dialysis or a kidney transplant. And many times people on dialysis do have diabetes, and that's what's caused it. Eye damage. Diabetes increases the risk of serious eye diseases such as cataracts and glaucoma, and may damage the blood vessels of the retina, potentially leading to blindness. Skin conditions. Diabetes may raise the risk of some skin problems, including bacterial and fungal infections. Slow healing. Left untreated, cuts and blisters can become serious infections, and they may heal poorly. Severe damage might require toe, foot, or leg amputation. Hearing impairment. Hearing problems are more common in people with diabetes. Sleep apnea. Obstructive sleep apnea is common in people living with type 2 diabetes. Obesity may be the main contributing factors to both conditions. Dementia. Type 2 diabetes leads to the increased risk of Alzheimer's disease and other disorders that could cause dementia. Poor control of blood sugar is linked to a more rapid decline in memory and other thinking skills. Living with diabetes can also affect your mental health. People with diabetes are 2 to 3 times more likely to have depression than people without diabetes. That's quite a list of complications. Now we're going to move on to the diagnostic tests, so that if when you go to your doctor, if he does any of these tests, you'll kind of understand a little bit more. First one we have is the A1C test, and these tests also need to be done and followed to confirm the diagnosis of diabetes. The A1C test measures the average blood sugar level over the past 2 or 3 months. Usually it's 3 months. An A1C below 5.7% is normal. Between 5.7 and 6.4% indicates you have prediabetes, and 6.5 or higher indicates that you have diabetes. So A1C is one that is followed very closely. Fasting blood sugar. This measures your blood sugar after an overnight fast of not eating. A fasting blood sugar level of 99 or lower is normal. 100 to 125 indicates you have prediabetes, and 126 or higher indicates you have diabetes. They will also do a glucose tolerance test. And this measures your blood sugar before and after you drink a liquid that contains glucose. You'll fast overnight before the test and have your blood drawn to determine your fasting blood sugar level. Then you'll drink this liquid and have your blood sugar level checked 1 hour, 2 hours, and possibly 3 hours afterwards. At 2 hours, a blood sugar level of 140 or lower is considered normal. 140 to 199 indicates you have prediabetes, and 200 indicates higher or higher indicates you have diabetes, meaning that your insulin cannot handle all this sugar. And then you have the random blood sugar tests, which you can do yourself, is the measure of your blood sugar at the time you're tested. You can take this test at any time, and you don't need to fast first. A blood sugar level of 200 or more indicates you have diabetes. And here's a little chart that you can see. The green is the normal, with the A1C below 5.7 or below, the fasting blood sugar 99 or below, and glucose tolerance 140 or below. And then the prediabetes is 5.7 to 6.4, and fasting blood sugar 100 to 125, and the glucose tolerance 140 to 199 is diabetic. And then true diabetic would be 6.5 or above. For the A1C, fasting blood sugar test 126, and glucose tolerance is over 200. When I was working in the hospital, we would get people in, and it was not uncommon to see an A1C test of like 10 or 12, which is really an out of control diabetic. And I've taken blood sugars before that have gone into the like 480. It's wild. So anyway, need to get these people help. Okay, the treatment goals is glycemic management or glucose management. A targeted A1C level in patients with type 2 diabetes should be tailored to the individual, balancing the anticipated reduction in the microvascular complications over time with the immediate risks of hypoglycemia or low blood sugar and other adverse effects of therapy. We do not want people to have their blood sugar too low, because that is a whole different problems in itself. A reasonable goal of therapy is an A1C of less than 7% for most patients. Improved glycemic management or sugar control management lowers the risk of microvasculations in patients with type 2 diabetes. For every 1% drop in A1C is associated with improved outcomes over the long term with no threshold events. Managing your diabetes. Unlike many health conditions, diabetes is managed mostly by you with support from your healthcare team, including your primary care doctor, foot doctor, dentist, eye doctor, registered dietitian, nutritionist, diabetic educator, and pharmacist, family, and other important people in your life. Managing diabetes can be challenging, but everything you do to improve your health is worth it. One of the things that I always like to say is that in order to successfully live with diabetes, you yourself have really need to take ownership of this. You can't rely on anybody else for your eating and taking of your meds and all this. You have to do it. You may be able to manage your diabetes with healthy eating and being active, or your doctor may prescribe insulin or other injectable medications or oral diabetes medication to help manage your blood sugar levels and avoid complications. You still need to eat healthy and be active if you take insulin or other medications. It's also important to keep your blood pressure and cholesterol close to targets your doctor sets for you and get necessary screening tests. You'll need to check your blood sugar regularly. Ask your doctor how often you should check it and what your target blood sugar levels should be. Keeping your blood sugar levels as close to target as possible will help you prevent or delay diabetes-related complications. Stress is a major part of life, but it can make managing diabetes harder, including managing your blood sugar levels and dealing with daily diabetic care. Regular physical activity, getting enough sleep, and relaxation exercises can help. Talk to your doctor and diabetes educator about these and other ways you can manage stress. Make regular appointments with your healthcare team to be sure you're on track with your treatment plan and to get help with new ideas and strategies if needed. Whether you were just diagnosed with diabetes or have had it for some time, meeting with a diabetic educator is a great way to get support and guidance, including how to develop a healthy eating and activity plan, test your blood sugar and keep a record of the results, recognize the signs and symptoms of high or low blood sugar and what to do about it. If needed, give yourself insulin by syringe, pen, or pump. Want to monitor your feet, skin, and eyes to catch problems early. Buy diabetic supplies and store them properly. Manage stress and deal with daily diabetic care. Ask your doctor about diabetic self-management education and support services and to recommend a diabetic educator, or search the Association of Diabetic Care and Education Specialists, and they can help lead you. Medications. Medication treatment is for lowering blood sugar levels. Several classes of type 2 diabetes medication exist. Each class of medication works in a different way to lower blood sugar. A medication may work by causing the pancreas to make and release more insulin, by limiting the liver's ability to make and release sugar, by blocking the action of enzymes in the intestines that break down carbohydrates, slowing how quickly cells take in carbohydrates, and improve cells' sensitivity to insulin. And what is the first medication for type 2 diabetes? It is metformin. Most everybody who's newly diagnosed will start on metformin as the first line drug. And in the absence of specific contraindications, metformin is initial therapy for patients with newly diagnosed type 2 diabetes who are asymptomatic. We begin with 500 milligrams once daily with the evening meal, and if tolerated, add a second 500 milligram dose with breakfast. Now, there is what they calling a new drug, but it's not really new. It's been around for 20 years, but it's just recently got a lot of press, so I thought we would talk about them. And these are the GLP-1 agonist, or glucagon-like peptide 1 agonist. And that would include Trulicity or dulaglutide, Victoza, liraglutide, Ozempic, which everybody's heard about these days, semaglutide, Mounjaro, tirzepatide, Byetta, extenditide, and I can't say these words, alexitide. Okay. But anyway, GLP-1s is a hormone that your small intestine makes that has several roles, including triggering insulin release from your pancreas, blocking glucagon secretion. Remember that glucagon is a hormone your body uses to raise your blood sugar levels when necessary. So GLP-1 prevents more glucose from going into your bloodstream. They also work by slowing stomach emptying. Slower digestion means that your body releases less glucose from the food you eat into your bloodstream and increases how full you feel after eating. GLP-1 affects areas of the brain that process hunger and satiety. A GLP-1 agonist is a manufactured substance that attaches to a cell receptor and causes the same action as a naturally occurring substance. GLP-1 medications bind to the GLP receptors that your body makes to trigger the effects or roles of the GLP-1 hormone. The higher the dose of the GLP agonist, which means it works with or increases the GLP, the more extreme the effects. In type 2 diabetes, it helps manages your blood sugar by triggering your pancreas to release more insulin. The slow digestion also helps decrease blood sugar spikes. The satiety effect of GLP-1 agonists reduces your food intake, appetite, and hunger. These combined effects often result in weight loss. They're a pretty new drug. I mean, there's a pretty cool drug, and they have been having all sorts of wonderful results from the studies about preventing heart disease, preventing stroke, preventing Alzheimer's. I mean, it's almost like a miracle drug that they're finding more and more out about. And there's several other GLP-1 type drugs coming that are in the pipeline right now and should be available in the next few years. And this can really help type 2 diabetes. Diet, which is the main key in controlling type 2 diabetes and prediabetes. A diabetic diet for type 2 diabetes focuses on controlling blood sugar levels and managing weight. And here are some general guidelines. Carbohydrates management. Choose complex carbohydrates such as whole grains, legumes, fruits, and vegetables over simple carbohydrates like sugary drinks, candies, and white bread. Monitor portion sizes of carbohydrate. Balancing carbohydrate intake with insulin or other medications can help control blood sugar levels. Fiber-rich foods include plenty of fiber-rich foods like vegetables, fruits, whole grains, legumes, and nuts. Fiber helps to regulate blood sugar levels and aids in digestion. Healthy fats. Opt for sources of healthy fats such as nuts, seeds, avocados, olive oil, and fatty fish like salmon. Limit saturated fats and trans fats found in fried food, processed snacks, and fatty cuts of meat. Lean protein. Choose lean protein sources such as poultry, fish, tofu, beans, lentils, and low-fat dairy products. Avoid processed meats and high-fat cuts of meat. Portion control. Be mindful of portion sizes to avoid overeating, which can lead to weight gain and spikes in blood sugar levels. Limit sugary foods and beverages. Minimize consumption of sugary foods and beverages such as soda, candy, desserts, and sweetened cereals. Opt for natural sources of sweetness like fruit. Regular meal timing. Try to eat meals and snacks at regular intervals throughout the day to help regulate blood sugar levels. Stay hydrated, which is my favorite thing. Drink, drink, drink. Drink plenty of water throughout the day. Limit sugary drinks and alcohol, which can affect blood sugar levels. Monitor blood sugar levels and keep track of blood sugar levels regularly and adjust your diet and medication as needed in consultation with your healthcare provider. Physical activity. Incorporate regular physical activity into your routine, such as exercise, can help improve insulin sensitivity and blood sugar control. Remember, it's important to work closely with a healthcare provider or a registered dietitian to develop a personalized diabetic plan that meets your individual needs and takes into account factors such as medication, activity level, and overall health status. And here we have another video all about food.
For people living with diabetes and for those trying to prevent type 2 diabetes, healthy eating is important for controlling blood sugar, blood pressure, and cholesterol. It's also really critical for losing and maintaining a healthy weight. When you have diabetes, your family members can eat the same food that you're eating and benefit from it because they are at higher risk for developing type 2 diabetes themselves. Maintaining a healthy weight for a person living with diabetes is critical to manage blood sugar, blood pressure, cholesterol, and to prevent complications such as heart disease and stroke. A target blood sugar range for a person living with diabetes would be 70 to 130 before meals and 180 2 hours after a meal. But the best thing is to check with your healthcare team about a target range that's good for you. For a person who's trying to control their blood sugars, carbohydrates that they eat have the biggest impact on the blood sugar. So knowing how many carbs you're eating helps you keep your blood sugar in a good range. And carbohydrates are found in fruits, vegetables, grains, dairy products, more places than you expect. A dietitian can really help you count carbohydrates and find the foods that contain them. Since so many foods contain carbohydrates and you're trying to get the number down to a level that helps your blood sugar, a dietitian will help you balance all of that. Eating a healthier diet actually makes you feel much better, in addition to having better blood sugars. For a person living with diabetes or trying to prevent diabetes and maintain a healthy weight, these foods can really help. Lean sources of protein, like chicken or fish, whole grain foods, crackers, cereal, vegetables, especially those that grow above the ground and the kind you put in salads, eating whole fruits in place of drinking juices, and using low-fat and non-fat dairy products like milk and yogurt. If making big changes in the way you eat seems overwhelming, think about small steps and try to find a quick win. One thing you can do to help you control your portions is you eat using a 9-inch plate. If you divide that plate in half and fill it with vegetables and fruits, that leaves you room on the other half for a quarter of the plate to be meat, probably about the size of a deck of cards for 3 ounces, and a quarter of the plate to be starch, grains or potatoes or bread. Try to eat your meals and snacks at the same time each day. And that way you won't get too hungry at any one time, which could lead to overeating. Take time when you're eating. Chew your food slowly and enjoy it. Give your brain a chance to know that your stomach is full. When it comes to seasoning your food, use herbs and spices. Leave the salt and butter on the side. Make a list when you go shopping and stick with it. Don't go shopping when you're hungry because that can lead you to some poor choices. Bring your lunch to work instead of eating out. This will help you control your portions and avoid overeating like you would in a restaurant. When you're cooking at home, wrap up and put away your leftovers promptly. This way you won't be tempted to go back for seconds. And think about stir fries. They're a great way for you to boost your vegetables and cut back on meat. Plus, they actually make very good leftovers. People fall off track all the time when they try and eat a healthier diet. It's normal. Don't get upset about it. Just try to get back on track soon after you fall off so you don't get totally derailed. It's normal to get discouraged periodically. Think about talking to a dietitian. They can help you tailor these diet recommendations to fit your needs and come up with a plan that's easier for you to follow. For a person living with diabetes, there are no special foods you need to buy. There are no foods you need to avoid entirely. With portion control and meal planning, even with diabetes, you can really enjoy eating.
And here's the plate that she was talking about half the quarter, half and quarter, is that non-starchy vegetables, carbohydrate foods, and protein. And again, drink. Physical activity. Incorporate regular physical activity into your routine can improve insulin sensitivity and blood sugar control. You want to aim for 150 minutes of activity per week, but really any amount helps, and it helps greatly. So remember, it's important to work closely with your healthcare provider or a registered dietitian to develop a personalized diabetic meal plan that meets your individual needs and takes into account factors such as medication, activity level, and overall health status. And my final thoughts. As you can see, diabetes is a very complicated disease with many factors that come into play. There are many actions that you can take to help prevent and help reduce your risk of developing diabetes. It is never too late to take action for your own health. You can help yourself manage diabetes by taking ownership and control of your lifestyle, be it by healthy eating, becoming physically active, regular health visits, taking note of how you are feeling, taking advantage of education offered, asking questions, and voicing your concerns to your healthcare provider. It's up to you. If you have any further questions or in need of education, feel free to contact me and I'll be happy to help. Peace be with you till we meet again, and peace out. Do we have any questions? Yes. Tom?
Is there any relationship between diabetes and pancreatic cancer?
I don't really know that. That's good. I can get back to you on that one. Let me write that.
I'm just curious, and you seem to see more and more pancreatic cancer surfacing.
And it's also because there's more and more tests too that detect it. So that may be an increase. But let me find that out for you, okay?
Thank you. Thank you for the presentation.
Well,
I have
yeah.
a question.
Yeah.
Yes, if on the tests for pre-diabetes, if one of the tests shows is in the normal range and the other one is in a pre-diabetic range, what does that signify, if anything? Or is it more common to have both the A1C and the fasting test show you have pre-diabetes?
Yes. Any kind of higher than normal levels would indicate some sort of issue going on, and it would definitely, you need further testing, and maybe in a month or two do an A1C again and redo the test and to see how that works. But there are going to be times where the different types of tests will yield different results, but it would, any kind of abnormal would require further testing.
Okay, thanks.
Any other? And, oh, go ahead.
No, I just said thank you.
Oh, thank you. Thank you for coming. And you can contact me either here at Derry Church. My email is care@derrypress.org, and there's the church number and my mobile number. So we're going to end it here. And thank you for coming, and stay safe and stay healthy.